I can't turn left. So she served it on a nice silver platter for me. But yeah, definitely less movement when there are more symptoms, better movement when there are less symptoms.
Got you. Stephen, do you ever have patients that have trouble with that question?
Oh yeah, absolutely.
When they have trouble with it, what does that mean just right off the bat?
Well, I would say my interpretation most of the time is either it's subtle and they're just not noticing it, but there are those that just are not good at paying attention to that either.
Yeah.
So, I'm always fishing, maybe asking it different ways or at different times, see if I get a different response. But, I'm not going to hit it over and over again if I'm not getting a clear answer. It's probably not going to be that valuable of an answer if it's that hard for them to notice. So,
great. Yeah. Okay. That's helpful. And then have you ever had patients that say, nope, I do not feel that I lose motion, and they turn out to be a derangement?
Yeah, I have. It's definitely more rare in that instance, but there are those, and maybe the derangement is at a level of the spine that they're not as mobile in, so they don't notice limitation in movement, but it still does change. It still rapidly changes. It still has directional preference. But when someone does not note movement loss, obstruction, your likelihood of derangement is certainly going down.
Mm-hmm. And Steve, do you ever have patients say, yep, I definitely feel that I can't move as well and I'm hurting more, and they turn out not to be a derangement?
I would say yes as well. Also more rare, but some people that are pain inhibited, when they have increased pain, maybe the motion in our estimation is there, but their perception is I can't turn into it. It's too painful.
Yeah, got it. Okay. Yeah, thanks for fielding those questions. Did you go into any sort of discussion about what is it that you do? Can you show me your posture, position, or whatever on Fridays and Saturdays that you think is so specific? Because you're showing unilateral symptoms, very kind of distinctly unilateral, right? So it almost makes us start to wonder, is she always approaching the patient from one side? And or those type of questions. Did you talk about that? And is that valuable to you?
Yeah, we did discuss that. And she was very much making lots of efforts on her part. She made comments to me about trying different positions, really trying to maintain good posture. She's aware enough of these things that
Month after month, new guest experts sharing actual patient cases and subscribers sharing their own challenging and interesting cases. Check out case conversations at mechanicalcareforum.com.